Hello friends, hi. I'm Dr. 𝗪𝗱𝗀𝗀. I'm the founder of Mortimer Green, which is one of the world's largest platforms for MRCS training. And I have with me Dr. Soumith Subhash. Congratulations, Soumith, for passing your recently concluded MRCS Part B examinations in Mumbai. So, Soumith, how does it feel, to reach the end of a major journey?
Thank you, first of all, sir. I can't express how happy I am. I actually didn't, as you already know, I didn't. I was in like a short span of time for me to prepare to due to certain reasons, and yeah, only the session that helped me achieve this was one session that I attended. That is a Mortimer Green workshop that I attended in Chennai,
So,
and
Soumith, tell
I
us a
couldn't be
little more
more
about
thankful.
yourself and your MRCS journey. So, what are you doing? Where are you working? And why did you do MRCS?
Myself, Soumith Subhash. I'm now doing my MCH in urology in Calicut Medical College, and I was talking about. I started with my Part A examination again with Mortimer Green when it was search test app. I contacted you and I did my Part A just listening to the videos and solving the questions that were provided by Mortimer Green. And actually, I had my surgery final exams and everything coming up. For due to that reason, I didn't take Part B. So immediately following Part A, I did delay my Part B for some time. And after, as soon as I passed my final surgery exams, and after I gave my uh, MCH entrance examinations, I appeared for my Part B, which is Mumbai Diet in December 4th. And this session was in November 25 and 26, I think, in Chennai. And it was just 1 week before the actual exams. So until then, to be honest, I had no, like, I didn't have the exact structure of the examination. I knew there was OSCE, there were like skills part, there is knowledge part and everything. I didn't know how the actual structure of the exam was and how to approach the skills part especially. And I had no other I had no other source. The skills part entirely was owned by Mortimer. And I remember that session of that angry patient. I actually presented the case in front of you, and I did get the angry patient. It was a CT cancel. Arthroscopy cancellation thing.
Arthroscopic.
Yeah, I remember you getting up and leaving, and you told me just don't go grabbing the patient, and. Yeah, yeah. The skills part, I can't.
So a similar
I don't
scenario
think
came
it.
in the exam also for you?
Yeah, yeah, yeah. It was cancellation of the arthroscopic thing, and the patient was really angry. And thankfully, he didn't get up or anything. I think that is the worst case scenario. But he did make it difficult for me. But it was I managed it actually. I because of that experience with you there in the session in Chennai, I did calm him down eventually, and he didn't have anything to get angry after that. He himself couldn't tell anything. I answered everything like whatever he had told me to answer, and he actually didn't have anything to tell. And then he just looked at the examiner, and that's it. It was
So
pretty.
tell us a little more about the workshop and how it was structured and how it helped you.
Yeah, the skills part and the communication part. Um, it was actually the problems that we actually will encounter there. That's exactly what is addressed in the workshop. The things like washing the hands before entering a station, saying wishing the patient, or wishing the examiner, or maybe thanking the patient before leaving. All these small things you will not. These are not mistakes if you think about in Indian terms, but these are great mistakes when you think in terms of MRCS. Because each thing, if you can see the examiner marking a tick or going to his examination board when you say thank you to the patient, like all that you can only get by practice. And even now, I want to make it very clear that you can't pass Part B with alone. You need somebody with you. You have to practice it with your friends. I had a friend, my best friend Suraj, he also passed Part B. We were both going through scenarios. Even the day after you gave us a homework on the first day. You should take a video. Actually, we did take a video. We have the guts to put it, send it to you. We had that throughout the night. we did go through all the scenarios that day itself, and yeah, only the practice will make it. The skill session, especially knowledge part, as you had already told, pathology and anatomy, you can't teach it. You just need to learn it. In this workshop, we didn't address it, but I think that you should cover it through the McMinn's, McMinn's pictures. That's it. Anatomy is 100%. They will only ask the cadaver pictures. I don't know about the other centers, but they were only asking cadaver pictures for it. And that is the McMinn's pictures. Yeah, exactly, from McMinn's. And the questions are or if you have gone through, there are Turkey notes and all. I think the similar questions as the ones they are asking. So knowledge part you can actually crack.
Anatomy, I would personally recommend, because I know you are just 1 week prior. For people who are trying to prepare, I would recommend a book by 𝗪ci 𝗻𝗀, the green color book.
Yeah.
For MRCS Part B. That's the
I did go through that also.
Yeah. And that's okay. That's perfectly okay. But for the benefit of the listeners who are listening to this interview. Yeah, okay. I think that it's fantastic, Soumith. I think couple of points summarizing what Soumith has said. It's very essential to have a partner. You can't do it alone. It's great if you have a mentor and attend a workshop which allows you to practice it. And the focus should always be on the communications, procedures, and for that, the workshop plays a major role. And for those listeners who are seeing this, Mortimer Green conducts workshops regularly. We have conducted more than 10 to 12 workshops over the past 3.5 years. And we've been focusing exclusively on training students for MRCS Part B, how to train the average international student who is not used to working in the NHS to the system in NHS, how they expect you to respond, how the patient expects you to respond, how the system, how NHS works, what is a consent form, how to take a consent, how would you do a particular procedure, how to take a history, how to be culturally sensitive while taking history. In fact, we go down to the basics about how to sit. And I think Soumith would have realized this. The first starts
sit
with
at the edge of the seat. You should always sit at the edge.
Yeah, so simple things like how do I sit? Should I cross my legs? Should I spread my legs? So basic stuff such as these, which make a huge difference when a lay examiner or the actor is watching you. And I think that makes a lot of difference. I think Soumith has managed it. Doing MCH, I think you're a first year right now. You're just joining right now. It's quite stressful, and I think just after NEET essays, I think it's a huge achievement. Congratulations, Soumith. I'm so happy for you. I think Soumith has become more of a friend because we have interacted multiple number of times for Part A, for Part B. I think we've been friends for quite some time. So congratulations once more. Wish you the very best, Soumith.
Thank you, sir. Thank you so much. I know yourself already that I couldn't have done this without you. I always when I think about MRCS exam, okay, I'll call Vinayak, sir. Even Part B, before even booking it, I call you, sir. I have to book for Part B because I have no other person to call. I know only you can help me out in this. So I just directly called you, and even booking the exam, you only help me out with that. So I told sir, it is going out. I just need to book it now. Can you help me out and all? And all throughout the entire journey, from even booking Part A till passing Part B, you were there all throughout the journey. I couldn't help. Thank you enough. Thank you, sir.
It's a pleasure and an honor. Great to see you pass MRCS Part B. Now you can rightfully put that MRCS post nominals behind your name, and hope to see you making a big splash in the urology scene very, very soon.
Yeah, thank you, sir.
Hey, good luck, Soumith. Thank you.
Thanks.